Some parents will be like, in their family, they don't take vaccines. And I'm like, what? I don't want to say what kind of family is that. Why will you just open your mouth and tell me in your families you don't take vaccines? Like, some were even telling us that there is this WhatsApp messages flying about saying the vaccine is to make their girls infertile. That so if their girls should take the vaccine, they will not be able to have children. What is the essence of their child taking that vaccine? That they will not have children. And we now have to start addressing the myth and misconception, because definitely something is wrong somewhere.
Hello viewers, and welcome back to another episode of The Voices of Regalo, a podcast powered by Regalo Hope Foundation, and I am your host for today. My name is Oriolua Abiodun, and with me in the studio is an amiable healthcare professional. I'm just going to read a profile briefly. So Nurse Oladele Ojo is a graduate of Lagos State School of Nursing and Midwifery, Igondo. She obtained her registered midwife certificate and practice license from the Nursing and Midwifery Council of Nigeria. She's been practicing as a registered midwife for over 5 years. She's worked with so many government hospitals and organizations. And fun fact, she has been a volunteer at RHF, a consistent volunteer at RHF for over 5 years. And if I would add the last fun fact, is the fact that she's the yummiest mommy in town. So welcome to today's episode, Nurse Oladele Ojo.
Thank you.
Thank you so much for being here with us today. So today we'll be we'll be treating a topic, the importance of childhood vaccination. So at Regalo Hope Foundation, we run sensitization programs regarding childhood vaccination. So we see that most of these deaths causes are from vaccines that could prevent those death occurrences in children, and this is why we run the vaccine sensitization program. So today with us, we're going to be discussing the importance of childhood vaccination. Welcome once again. I think first, before we start delving into the topics, I'd like to ask, because most times people use vaccination and immunization interchangeably, and we don't exactly know the distinct difference between vaccination and immunization. So if you could just help us differentiate.
Okay, thank you for having me, and I'm the yummiest mom in town.
Yummy.
So yes, you can actually use both interchangeably. Vaccination and immunization goes hand in hand. It depends on what you're trying to say, but the notable difference between both is vaccination itself is the process of taking the vaccine, of getting vaccinated. You are taking the substance into your body. That's vaccination. While the immunization is the process of becoming immune to the disease or the infection you are being vaccinated towards. So the immunization is like combination of the vaccination, the vaccine you're taking, and your body building resistance towards that particular infection. That's, you are building immunity. That's where the word immunization comes from. But the vaccination is process or the act of taking that substance into your body.
Wow. So that means that immunization could be in various forms. It doesn't only have to be a vaccine.
Yes, it can be done orally, use of
so if I take a drug, I'm immunizing myself.
Yes, don't use drug before someone will say.
No, I mean like medically approved drugs.
Yes.
Okay, so I think we'll go to the next question. So, all right. So I know you touched a little bit on what vaccination is about, right? And it's often said that vaccines save life, right? So I just want you to explain, like, for parents in underserved communities, what exactly is vaccination and why is it important for their child early care?
Yes, vaccine saves lives. That's very true and correct. And why it is important for parents in underserved communities to vaccinate their children is because there are a lot of vaccine prevented diseases that these under 5 children, we focus majorly on 0 to 5 years of age. So when these children take this vaccine, it protects them against these deadly diseases and illnesses. So parents in underserved areas can always take their children or their child to the nearest health facility, be it a primary care center, be it a general hospital, wherever they are giving vaccine. It is free, doesn't cost them anything. even if they stay in a very distant location to where the health facility is, there are some people that have strategically positioned to go to the communities themselves on weekly basis to reach out to other children that their parents are not able to bring into the health facility for vaccination. So that way we're able to cover a larger sum of children that are being left out, because the I think the goal is to make sure no child should die should be found dead
Certain diseases
with
that
certain diseases that
are prevented.
yes, that vaccine can prevent. So
Yeah, that's important. I also know that I know you work a lot with, in this community rather, for example, you work mostly with most of these women that maybe they are nonchalant, or they're not exactly, or they have misconceptions in their minds regarding certain vaccines or certain. So I don't know if maybe in your experience you've come in contact with one or two parents who have misconceptions or myths or certain things they say cause them not to take their children for vaccinations.
Yes. I have a notable example of 2023.
Okay.
That was when there was this awareness was created by the Federal Ministry of Health for the human papilloma vaccine, and we're focusing more of girls of 9 years to 14 as at then. So there was a lot of jingles on social medias, radio stations, television stations about the importance of this particular vaccine. And there was great turnout for people or for communities that are more civilized, so to say, community or the riverine or the rural community. Let me use rural. I think rural is more safer. So in rural communities, and the moment the program kicked off and we are going from schools to schools, houses to houses to vaccinate these children, people were literally keeping their children inside the house. They are like, no, they've already heard about this particular vaccine. Some were even telling us that there is this WhatsApp messages flying about saying the vaccine is to make their girls infertile. That so if their girls should take the vaccine, they will not be able to have children. What is the essence of their child taking that vaccine? That they will not have children. And we now have to start addressing the myth and misconception, because definitely something is wrong somewhere. So a lot of parents are like that. A lot of people are like that. They pick up one thing and they build on it, and that is it. You do a lot of work to make sure you address that issue. So a lot of more awareness were actually created for those kind of people. We involve the community leaders and the likes.
Yeah, I remember that in our conversation prior to now, you mentioned how that some parents, they actually are aware. It's not like they're not aware, but like they're just nonchalant. They don't want to take their children for those vaccine schedules, or they give excuses.
Exactly.
What would you like to say to some of these parents?
Exactly. See, that's one funny thing. Some parents will be like, in their family, they don't take vaccines. And I'm like, what? I don't want to say what kind of family is that. But how will you just open your mouth and tell me in your family is you don't take vaccines? Like, do you even know the importance of what you're taking? This thing is at no fee. There is no cost attached to it.
The government has done that much.
Yes. Because government is putting in a lot of effort, a lot of funding into bringing these vaccines. And these vaccines, before any vaccine can be given to a child or to any individual, it must have gone through series of testing and clinical testing, laboratory experiments and all, and it's been certified that it is safe for consumption to be administered for use before it will be taken out. And before you start hearing people saying, okay, there is this new vaccine you should take, this, there is always clinical trials before those vaccines are being brought out for administration. So I really don't know what else to say. I don't know what the issue is.
Yeah. Okay, so I think we'll come back to that, but let's just touch on, I know that there are like various schedules for vaccinations, especially for children. So like, can you just give us like a brief run through of what the schedules are like, if there's maybe a card, how they keep track of these vaccinations?
Okay, now I remember. Okay, so I want to go. So yes, there is a vaccine. There is an immunization schedule, and the immunization schedule differs from country to country. So what we might be using here in Nigeria might be different from what other countries are using. So the Nigerian immunization schedule covers from age 0 to 5 years of age, and then at age 0 to 2 weeks, your child is expected to take some vaccines, and some of which are HBV, that's the hepatitis B vaccine. There is the BCG that protects the child against tuberculosis. There is the OPV, oral polio vaccines. And polio vaccine is in two forms. There is the OPV, the one I just mentioned, and there is the IPV, the intermittent polio vaccine. And that prevents the child from polio, basically. So from 6 months and 6 weeks rather to 10 weeks to 14 weeks, the child comes in space of 1 month and 1 month each, like 6 weeks. The next appointment will be in 10 weeks. This child will come to take some certain vaccines also. Like, it's still the same vaccine, but it have to be taken in different stages and 1 month apart, where you'll be having the pentavalent vaccine. That's the one that they usually put in your baby's left thigh. I know mothers can relate to that, and there are others that the child will take in the right thigh, and then there are the ones that the child can take that is usually administered through the mouth orally. That's the rota and the oral polio vaccine, so and so on and so forth. At 9 months, the baby comes for measles, yellow fever vaccine, and meningitis A. Then at 1 year, vitamin A, and 1 year 3 months, the measles 2. Then it keeps taking vitamin A at 6 months interval till the child is 5 years old, and the essence of the vitamin A is to prevent blindness. That's the essence of vitamin A. Thank you.
So thank you for that breakdown. I couldn't take everything in, but I know that most parents that need it, they'll be able to jot that down. Yes, they can relate. Exactly. I think prior to now, we also mentioned, we were speaking of how some parents don't exactly come at the right schedule for each appointment. So I think some parents need to know what happens when they miss an appointment, because they just feel like, oh, my child just missed one, I'll skip to the next one, and when I come, they'll just collect it.
The thing there is about missing appointments, most times we say it at all times in the health facility when we are talking with parents about the vaccines their children is taking, and the sites and the possible side effects. When we talk about those things, we tell them to try as much as possible not to miss their child's immunization at the scheduled dates. Yes, because if you miss it, it might happen that child might probably outgrow that vaccine before you come. But the way the immunization schedule is being structured is that even if you miss a particular vaccine, this appointment, whatever time you come back, we are starting from that one that you missed, to ensure that that child doesn't miss out. We are trying to prevent this killer diseases by all means. So from age 0 to 5, you are still covered, and from age 0 to 5, you are covered to take this vaccine. So let's say, for example, you are supposed to come for your next appointment. You've taken your 6 weeks vaccination, and we've given you a month appointment to come for the second dose of those vaccines, and you missed it. Probably you traveled, it's a festive period, or there was an event in the family, sweet, bad event, whichever one, and you are coming back a month or 2 months or 3 months time after. We are starting from the next dose you're supposed to take, and we'll always tell the mother to not to miss next one. And sometimes we do visits We trace them. We make sure that these children, by all means, they must be covered. And we let the mother know that this thing is very important. We reinforce the importance of the vaccination.
I think that's beautiful because it shows that the structure of the vaccine program it's really structured.
It's structured.
In that even if you miss one, you can come back and start where you stop.
The rest is left to the parents to do their own quota. That's our own quota. We've done our own part. So it's their own part to bring their children.
That's beautiful. And I think I know that some people have this conception of the fact that if even if you take a vaccine, it's supposed to protect you for life. So what happens when you take a vaccine and maybe that sickness comes and they're like, maybe this person took measles vaccine and now they have measles,
So what, in my own experience, or let me just put it in my own word, I don't buy the idea of when you take a vaccine it covers you for life. And taking, for example, something like measles, the essence of taking this vaccine is to prevent you from these killer diseases. Because if you don't have defense, if your defense system, your immune system is not well equipped for this killer diseases, it might eventually cause some serious ailments and eventually leads to death. So now we are looking at these diseases or infections or sickness not leading to death. So it's protecting you from that death. So I would say it's reducing the virulence or the evil occurrence of losing your life.
Yes. So it, in some cases, it might not totally prevent the illness, but it has reduced the effect it can have on the person.
Yes, exactly. It can reduce the effect it's having. So I was very sure my mom took me to be vaccinated for measles while I was young, but I think I was 20 thereabout, and I had measles, and the thing was like, but they say if you take this vaccine, you are not supposed to have it. Then I begin to ask questions, and then it came to my understanding that it does not necessarily mean you will not have it. You will have it, but you are not going to die from having it. So it won't kill you.
So I just like you to maybe just mention a few other maybe health implications that not having the right vaccination at the right time could cause for certain children.
Okay, so not having some vaccines or not having the right vaccines at the right time might cause a lot of diseases or illnesses like we've been talking about. Like I was mentioning about BCG preventing the child from tuberculosis infection or disease, and then hepatitis B vaccine preventing that child from being exposed to hepatitis B virus that affects the liver, and also the tetanus vaccine. And I think that tetanus is already in the pentavalent vaccine. So yes, tetanus, taking the pentavalent vaccine prevents the child from those killer diseases like diphtheria, pertussis, tetanus, and the likes. Then if these children don't take this vaccine, it does not really, it affects every part of their whole being system, because the child that is well vaccinated is more healthier, so to say, or is prevented from a lot of killer diseases than that child that is not vaccinated. So for someone who doesn't take the polio vaccine, you see those kind of children having crippled limbs. They might not be able to walk around, and it's a lot.
It's a lot. It's a lot. It's a lot. Take your child for that vaccination today. So to just wrap up, any final words for parents unsure of vaccination? Maybe they still have misconceptions, which I believe we've addressed already, but in case they still have, one or two words you just have for them.
Okay, what I will have to say to our parents, our mothers, and let me even involve the father, because we are running, or should I say, yes, we are looking at inclusiveness, including the fathers, the dad, in the care of their children. So some mothers might be nonchalant, but I think when the men are more involved, they take it more seriously. So what I would just say to the parents is, vaccinate your child today. take them to the nearest health center, to the nearest hospital, to the nearest health post to get vaccinated, because that is one thing I feel you can give them at this age and time, that they can't speak for themselves. So they trust you wholeheartedly to do well with their care optimally. So this is the care you can give them. Because when this child are healthy, even you spend less on them.
Yes,
you spend less on them. You don't start taking them to hospitals for pains that the vaccine you are giving would have cured. So that's all I have to say.
Thank you so much. So to wrap up, we're telling parents, fathers and mothers, to please see to it that their
even
children,
guidance,
to see to it. And I think some parents come up with the excuses of finances. They don't have the resources to transport themselves, but I think that the government has tried to make most of these things available in healthcare centers. So thank you once again, Nurse Oladele Ojo, for joining us today on this interesting topic. So we've heard the voice of Nurse Oladele Ojo today, and so we've come to the end of today's episode. So we'll see you again in our next episode. Stay tuned.